Hello, my name is Kristina Nicole Martin and I work at the University General Hospital of Catania in Sicily. What do you think I do here? Perhaps you think I'm a doctor or a nurse. Well, I'm a biologist, and precisely a microbiologist in specialization. And I'm so glad that I made it to where I am today, and it's all because since middle school I kept following my passion for this subject. And microbiologists have to deal with many things, but not with patients directly. In fact, we are the ones that hide in laboratories, but give out results that can save people's lives.
For example, the other day we examined a blood sample for the research of malaria, a disease that kills thousands of people each year. And thanks to the capability of my professor of parasitology, we diagnosed Plasmodium falciparum, which is the protozoa that causes one of the most terrible forms of malaria, and if it is not diagnosed and treated quickly, could cause rapid death in certain patients.
A couple days later, we heard that the patient had started treatment and was doing much better. These are little moments of big satisfaction in our work.
In this particular period of time, the virology laboratory is really busy due to COVID-19. We process hundreds of samples of nose swabs every day for the molecular research of the RNA of coronavirus, and we always try to keep ourselves updated with the newest technologies.
Other than COVID-19, we perform many other different types of tests. For example, those of clinical importance for pregnant women, such as the research of cytomegalovirus or rubella virus, that could be the cause of serious clinical disorders in newborns.
In our mycology laboratory, an example of an urgent test that could be requested is identification of Cryptococcus, a fungus that can cause a dangerous meningitis, especially in individuals with HIV, and which is detected using a latex agglutination assay.
Last but not least, in bacteriology, we perform many tests for the identification of bacteria from all different kinds of samples, like blood cultures, swabs, and many others. For the research of some threatening bacteria, like the so-called superbugs, such as Klebsiella pneumonia, resistant to carbapenems, or methicillin-resistant Staphylococcus aureus, also known as MRSA. It's also important, though, to remember that humans are colonized with millions of microorganisms, and that without them, we wouldn't be able to survive.
When the sample of the patient arrives in our laboratory, we use different types of media to help the growth of the bacteria that are eventually present in the sample, and we wait usually the next day to observe the growth. During observation, it's fundamental to distinguish the good bacteria, the ones that are usual residents of the human body, from the bad bacteria, the ones that can cause infections, and we can do this thanks to the different characteristics of the colonies of each bacteria, such as color, dimension, and smell due to their different metabolism.
We also perform antibiotic susceptibility tests in order to give out results to the doctor to grant the best treatment for the patient. In the last years, we are assisting an increase of antimicrobial resistance worldwide. As a result, medicines become ineffective and infections become difficult or impossible to treat. The World Health Organization declared that antimicrobial resistance is one of the top 10 public health threats facing humanity. Since 2015, the World Antimicrobial Awareness Week has been held annually to raise awareness of antimicrobial resistance and encourage best practices among health workers. In this micro-world, there is still so much to discover. Thanks to comparing ideas with my colleagues, we can arrive to the best solution to help the patient. I'm so grateful to all of those who helped me in my course and for the great enthusiasm I have for what I do. Remember, behind the results of your analysis, there could be a microbiologist.